Believe it or not, you can live without a stomach.
You can live without a stomach, but would you want to?
If doctors remove it due to disease, your esophagus connects directly to your small intestine.
So this is sometimes done like a total gastrectomy, it's called, where they remove the whole stomach. Usually this is done for cancer and a few other rare diseases.
Food skips the stomach and goes straight for digestion. But without a stomach, your body can't store food, so you'll need to eat smaller, more frequent meals.
You'll also have to chew thoroughly. You'll need nutrient-dense foods, and you'll need supplementation as well. Also, the long-term considerations, you'd have weight loss, lifestyle changes, and you'd need follow-up care on a regular basis.
Thinking about cutting off a mole at home? Stop right there. It's risky. Moles aren't just harmless spots. They're connected to tiny blood vessels. Cutting one off can cause heavy bleeding, and if it's deep, you might hit a nerve or risk infection.
So this can cause all sorts of problems for the amateur do-it-yourself at home.
Worse, some moles can be cancerous, and cutting them won't stop it.
If you cut off something called a melanoma, that's a big problem because melanomas can be lethal. You never want to cut off a mole at home. Like this video says, you're opening up your risk to infection, bacteria, and delay of medical attention, especially if it's cancerous.
Ever wondered how a tracheotomy works? When breathing is obstructed, a doctor makes a small incision through several layers of skin and tissue in the neck.
Tracheotomy tube is used when the upper airway is compromised or when a patient needs long-term ventilator care.
They insert a tube into the windpipe, bypassing the blockage and allowing air to flow directly into the lungs. It's a critical, life-saving procedure that can restore breathing instantly.
It's crucial for individuals who cannot breathe on their own or need respiratory support. This procedure is very life-saving when it's done properly.
The surgeon starts with a small cut in the lower abdomen and moves through the fat layer underneath.
What happens during a C-section? Before that, there's anesthesia that's delivered. IVs are placed, the patient's monitored. Usually a catheter is inserted in the bladder to get urine, and then the abdominal is prepped. And then the incision happens.
Then, they carefully open the tissue over the muscles and gently push the muscles aside.
This is usually done what we call a bikini cut, which is very low, many times in the bikini area, in the pubic area, so that the scar is less visible.
Next, they make a small cut in the uterus, deliver the baby, cut the umbilical cord, and remove the placenta. Once everything is clear, they stitch each layer back together for proper healing.
So usually throughout this procedure, there's monitoring that happens. The mother is moved to the recovery room. Pain management takes place, so her pain's minimized. And the hospital stay usually takes a couple days before the patient's discharged.
When you exercise, especially with weights, you create tiny micro tears in your muscles.
This is true. This also creates tension, which basically causes anabolic processes in the muscle to start to take place.
This is how muscles grow. Your body quickly repairs those tears.
Right, this causes some inflammation and damage, which sets off a whole repair mechanism, which is part of the anabolic process.
Fusing the fibers back together and making them thicker. This process is fueled by protein and happens while you rest.
Exercise, especially resistance training, creates mechanical tension and muscle damage, triggering an inflammatory response and activating satellite cells. These processes stimulate muscle protein synthesis, leading to muscle fiber hypertrophy and growth and increased muscle mass and strength.
When you get stitches, the needle and thread pull your skin together, closing the wound tightly. This helps prevent infection by keeping bacteria out.
Large wounds, you can have a raw opening there. Obviously, that could get dirty, get infected. Stitches help close them.
Next, the wound may become inflamed, which is a normal part of healing. Inflammation and collagen bring cells that start repairing the skin tissue.
So the stitches bring everything together, which facilitates healing in this process. You can have inflammation, collagen bringing in to make the wound strong.
These cells turn into new tissue and repair the wound. Over a few weeks, the wound will have healed together and the stitches are removed.
To minimize scarring, you want to put those skin edges really super close together. I usually do a 3-layer closure where all the stitches are underneath the skin, but you could still rip your stitches open. So you have to be careful. A large wound like this, you can't really do any heavy exercise or anything like that for a few weeks.
Ever heard of extra teeth growing in your mouth? It's called hyperdontia,
It's also called extranumerary teeth.
and it happens when a special type of tissue in your jaw keeps making more teeth than needed.
This can happen through genetics, or it's something called dental laminar hyperactivity. Overreactivity of this tissue can lead to extra formation of tooth buds. In some rare cases, can also happen to environmental issues, although less common, such as trauma to the jaw could potentially contribute to this.
If they don't cause issues, they stay. Otherwise, dentists remove them. What if doctors had to remove one of your lungs? Sounds scary, right?
So this is called a pneumonectomy, surgical removal of the lung.
But it happens due to diseases like tuberculosis, lung cancer, or severe trauma. When this happens, the remaining lung expands and works harder to supply enough oxygen.
The other lung can compensate to a certain extent, and basically it takes up a little bit more room, pushing some of your organs to the side, but it is definitely survivable.
The surgeon removed a large portion of the man's skull,
This is common in brain surgery when you have to get in there.
intending to reattach it later during an emergency brain surgery. After several weeks, his brain had healed and was ready for the piece of his skull to be reattached. But the hospital staff couldn't find it. So instead, they used a synthetic piece, which later became infected.
But this is really horrible. They lost track of that. Yeah, anything foreign in the body, any type of implant always has a risk of infection. That's sad.
And the hospital still charged him $19,000 for the synthetic piece.
So hospitals will always charge. You know, that's the way they work.
Now the man is suing the hospital for negligence, seeking compensation for his suffering and medical expenses.
Yeah, I'm sure he's going to get a good payday with that.
If you swapped brains with your mom, would you be you inside your mom's body?
First of all, obviously this is not possible. Once you sever the spinal cord, you can't put it back together. Then there's immune rejection, and there's all sorts of ethical issues associated with this. I don't think you would be you or your mom would be you, but it's kind of an interesting topic for debate.
If your nose gets sliced off, doctors can place tissue expanders under the skin of your forehead. Once it is stretched out enough, they'll shape it into a nose. Then they take some cartilage from your rib cage and craft it into an internal structure.
So this is interesting. I've not really heard of using a tissue expander to expand it. What they do is they can rebuild cartilage. They can take it from your ear. They can take it from your rib to rebuild the cartilage. And then they would usually use a forehead flap to cover it up, and they might use some internal flaps to create the lining. But that's the most common way I've heard this done.
Seen someone with extra fingers or toes? It's called polydactyly.
So this can be genetic and environmental. Also, some people basically have these and don't have any problems whatsoever, but they can also be related to certain syndromes, which are genetic.
This happens when a small change in genes sends extra signals while a baby is developing in the womb. As a result, an extra finger or toe forms. Some are fully functional, while others are just small bumps. Would you keep an extra finger if you had one? Let me know.
So would you keep an extra finger if you had one? Well, most people are otherwise healthy. It can be related to sometimes exposure to certain chemicals during pregnancies, which can cause this, but also certain syndromes as well.